What's up, beautiful people? My name is Dr. Daniel Ricciardi. I help clients resolve small intestinal bacterial overgrowth and other gut-related conditions so they can feel and look their best. The video I have for you this week is on the relationship between hormonal contraceptives and small intestinal bacterial overgrowth. Just as a disclaimer before I start, all I'm doing in this video is to try to give you the facts, science, and information behind what is actually happening physiologically in your body when these products are taken. I'm not trying to convey any personal, political, religious beliefs. I'm not trying to tell you what you should or should not do, just trying to lay out the facts for you. And then after you hear them, you can decide on your own what you'd like to do. So with that said, obviously, in addition to performing its primary task, hormonal birth control can unfortunately have some negative impacts on the gut, which I'll get into right now. So the first one I'll talk about is how it can slow the activity of the migrating motor complex, or MMC. The MMC are nerves that control smooth muscles in the lining of the intestines, and this moves food from the top of the digestive tract down to the end. So if this is impaired, you can kind of think of a pond forming instead of a river. Where a pond, you can get a lot of kind of bacterial buildup, and it kind of looks a little more murky water from things just kind of growing there, as opposed to a river where it looks more clean, depending on the pond and river that you see or ones you look at, but that's just the way I try to like to remember it. So there's definitely an increase in the amount of time that it takes food to go through the intestines, and as a result of this, bacteria can form and kind of flourish more in this area. Secondly, taking hormonal contraceptives can affect the contractility of smooth muscles. One in particular is a small valve in the lower right quadrant of your body. If you draw a line kind of from your belly button to your hip bone, it's called the ileocecal valve. And this valve actually separates the large from the small intestines. Why is this important? Because most of the microbiome or bacteria in the body live in the large intestines. They are not supposed to be in the small intestines. If this valve or gatekeeper from the large to small intestines is not closed properly, you can get a ton of bacteria entering the small intestines, and this is very apparent why it can be bad and cause SIBO. So another fact on the ileocecal valve, like I said, you can kind of locate the area between belly button and hip bone. If you press on it and it feels discomfort, you feel discomfort, pain, tenderness in that area, it's possible that this valve may be stuck open, and it may be something that you can go to your doctor or have someone look at for you. Third, hormonal contraceptives can have a very negative impact on gut flora in reducing amounts of good bacteria. When we're looking at the microbiome, think of it kind of as a habitat. You want kind of a proper amount or equal balanced amount of every species. If some species are wiped out, you can see a dramatic increase of other species, and everything just gets kind of thrown off kilter. A variety of bacteria and microorganisms is great to have in the microbiome because they all produce different vitamins such as B12, short-chain fatty acids, help with digestion and absorption of other nutrients, calming the immune system as well, which is a huge one, which is kind of one of the things the microbiome evolved with our body, evolved side by side the immune system to do. So if these things are thrown off, it can kind of have a domino effect on many things related to our health and reducing the good bacteria. Fourth is hormonal birth control can increase intestinal permeability, which is also known as leaky gut, and as I mentioned previously, increase the amount of inflammation that we have in our body. So when looking at the small intestines, it's a one cell thick lining, and if this lining becomes damaged and the cells become spaced apart, keep in mind the immune system is sitting directly under that one cell layer. So if the immune system is exposed to all these things it's not supposed to, it'll kind of go haywire and react to everything. And that's when you can get a lot of inflammation leading to other disease states. Some in the digestive tract, which hormonal contraceptives are linked to as shown by studies, such as Crohn's disease and irritable bowel disease. But there's also links to tons of other diseases such as asthma, allergies, dementia, you name it. So that is all the main points I have for you in this video today. As a summary, Four things I talked about were hormonal contraceptives can slow the migrating motor complex. They can reduce or affect smooth muscle contractility, specifically of the ileothecal valve. I'm having trouble talking today. They can reduce good bacteria in the gut flora. And lastly, they can cause intestinal permeability, leaky gut, and lead to inflammation. And just as a side note past this, if you are somebody you think you're struggling with SIBO and you're getting treatment for it, make sure you ask the doctor, what do we think actually caused this? And then as a follow-up question, make sure they're doing something to actually resolve the root cause of it. Because if you're just throwing an antibiotic at it per se, it may go away in the very short term, but if it does, you're probably going to get a recurrence of it. So just please keep that in mind. So that is actually everything I have for you today. Thank you so much for tuning into this video. If you did enjoy it or it was helpful, please like and subscribe. If you have any questions, please leave them in the comments below. My bloating and gas guide is still available on my website at drdanielricciardi.com. Stay tuned for another video next week, Monday, 6 p.m. Central Time. Thank you very much, everybody. Have a good day.